Good afternoon, everyone. Welcome to ROAR 2021-2022. It is a pleasure to invite you to our series this year. As you know, we had a wonderful series last year led by Dr. Daryl Gray and the Anti-Racism Action Plan. And we look forward to a great series this year. The umbrella theme for the series this year is integrated care across the lifespan, from family to community, and the impact of racism. There were many individuals who came together to put this together. And with that integrated theme, we thought it appropriate to add co-chairs for the Roundtables on Actions Against Racism for 2021 and 2022. The new co-chairs I'm happy to introduce are Dr. Valencia Walker, Associate Chief Diversity and Health Equity Officer, Nationwide Children's Hospital. She's also the Associate Division Chief for Health Equity and Inclusion in the Division of Neonatology in the Department of Pediatrics at The Ohio State University College of Medicine. The second co-chair is Dr. Dina Chisholm. She is the Director of the Center for Child Health Equity and Outcomes Research, as well as the Vice President for Health Services Research at Nationwide Children's Hospital. So with our theme, integrated care across the lifespan, from family to community and the impact of racism, we thought it appropriate to have two perspectives on that theme. The first will be provided by Dean Bradford, and the second one will be provided by Dr. Walker. Dean Bradford, please give your perspective on our theme for the year.
So thank you so much, Dr. Joseph. So good afternoon. As Dean of The Ohio State University College of Medicine, I am a fierce advocate of health equity and addressing social determinants of health, including racism in all of its forms. Eradicating racism in all of its forms, achieving health equity, and addressing social determinants of health, all of these things are critical to integrated care across the lifespan, from family to community. I'm here to provide some background and share some of our college, medical center, and university level action steps to achieve health equity and reduce health disparities in our community. I believe that The Ohio State University is poised to lead the way in this effort. We know what the research says, that long-standing structural racism and discrimination are the key contributing factors to social determinants of health. Social determinants of health contribute to the onset of disease and are responsible for increasing disparities in physical and mental health among Black, Indigenous, and people of color. We know from the Ohio Department of Health's research that neighborhood income and education affect a wide range of health functioning, risk factors, and quality of life outcomes, which are collectively called social determinants of health. Social determinants of health include factors such as access to healthy food, affordable housing, and preventive health care. Research also shows that health disparities decrease when the members of the healthcare team mirror the diversity of the communities they serve. To remedy this, our college is increasing the number of underrepresented medical students and faculty, and increasing representation of members of under communities and at all levels of our organization. In addition, we are working with the university's RAISE initiative, which stands for Race, Inclusion, and Social Equity, to build an academic community that is attentive to shifting demographics and addressing social determinants of health. This hiring and retention effort will add 50 new faculty members and 10 postdoctoral fellows across campus and build world-class research programs on social equity and racial disparities. Because we need to ensure that all members of our healthcare teams deliver compassionate, safe, high quality, and equitable care to every patient, we are expanding research to include population health and health services and implementation science. The Wexner Medical Center has appointed an interim chief health equity officer and interim director for the university's Center for Health Equity to build partnerships and infrastructure to augment education, care delivery, and investment in community health. We know that these actions are just small steps towards meaningful change, but we are deeply committed to ongoing assessment to improve upon our efforts to advance health equity for all. Thank you.
Thank you so much for that, Dean Bradford. We appreciate you for being here today and for providing that perspective. Dr. Walker, tell us a little bit about integrated care across the lifespan from family to community and the impact of racism. What does that mean to you and to all of your colleagues at Nationwide Children's Hospital?
Absolutely. Thank you so much for just opening it up this way. And it's okay, I just want to take a moment and take a step back. We're using the word racism, but one of the things I've learned in having conversations with people is that everyone often has their own perspective on what they think that means. And I think for us to really have this conversation today, we should start with a shared definition. So Dr. Kamara Jones, a physician, a health equity scholar, has this definition, which I think really works for our conversation today and really helping people come together around why we need to address racism in the ways that we're choosing to address it. So in her definition, racism is a system of structuring opportunity and assigning value based on how people interpret the way other people look. And we use that to then we say race, like, Black people have a certain melanin content in their skin, other physical features and things of that nature. But the thing about the system is that it unfairly disadvantages some, not all, some individuals and communities, unfairly advantages some other individuals and communities. But the key to her definition is she points out the fact that it saps the strength of the whole society because we're wasting human resources. We are preventing people, which is what health equity is, from achieving their best possible selves. And we're all doing this based on some interpretation of how people look, but then we've created this system. And that allows us to understand it's not either intentional or unintentional. We can't always say which it is. Sometimes we do know. But that's how it's able to be structural and really get into things that we don't often think about. And so how does that affect children and babies? I'm a neonatologist. I take care of babies, and you would think everybody loves babies. I mean, most people do. They're pretty cute. I'm biased. But we see that there are differences in opportunities that babies have and the way that babies are even treated when in the hospital. And then we look out over our communities and ways we can partner to help. So at Nationwide Children, and I'll talk a little bit more about this as we go through the conversation today, we had already started understanding that we're not just a place that we're supposed to kind of swoop in, rescue, and send you back out into the same environments that are harming you. And also when you come to us for healing, we have to be a place that doesn't perpetuate harm. So we have our STAND initiative, Stand Against Racism, Stand for Health Equity. And we're literally going through and thinking about every single system and structure, how we hire people, how we promote people, how we create policies around the way we distribute care, how we partner with our communities, making sure that communities have a voice and that we understand that different communities have different needs, and making sure that we're building up the communities around us. And so many people may know about our healthy families, healthy neighborhoods. And that was one way we're getting started. But more and more, we're saying we have to name racism, understand our blind spots, and continually strive to improve to do better. So I'll stop there for now because I know we have a lot of great stuff to talk about today.
Thank you so much, Dr. Walker, for providing that expert background to really ground us all in this topic. So really appreciate that and really appreciate all the efforts of Nationwide Children's Hospital. And so next, I would like to introduce our topic for today. ROAR, bringing statements against racism to life, how public health and healthcare systems are moving beyond the statement to action. And I will introduce our panelists, Dr. Maishika Roberts, Health Commissioner at Columbus Public Health, Dr. Leon McDougall, Chief Diversity Officer, The Ohio State University Wexner Medical Center, and immediate past president of the National Medical Association, as well as Dr. Valencia Walker, who you already heard from in the opening session and was introduced previously. Thank you so much, first off, Dr. Roberts, Dr. McDougall, and Dr. Walker for spending a little time with us today. And I will ask the first question to Dr. Walker. Down here. So Dr. Walker, in terms of the patient experience, what is the hospital's role in addressing bias, racism, and being culturally aware?
Absolutely. So I mentioned this earlier, but I want to state it very clearly for people to hear. When you come to a hospital, you're coming because you're seeking care, because you're sick, because you don't feel well, because someone you love doesn't feel well, and you're trusting us to provide care. And when we provide care, that care should be compassionate. It should be restorative. We should not be creating harm. We should be ensuring that it is a protected space of healing. And healing should be all encompassing. When we think about a holistic approach to healing, that it's not just putting in a stitch, it's not just giving you a medication, but it's really helping you to overall have health and well-being. And the hospital can't divorce itself into merely a profit generating center, or just some place where we've checked the box and said, we have decreased our number of hospital-acquired infections. If we aren't recognizing how different people are going through that system differently. So when we think about that role of healing, that means not perpetuating harm and not perpetuating trauma in any sense of those two words.
Perfect. Thank you for that, Dr. Walker, and very important points there. I'll go to Dr. Roberts next. In terms of persons living in Columbus, you announced at Columbus Public Health racism as a public health crisis here in Columbus. What is CPH's role in addressing bias, racism, and being culturally aware in our community here in Columbus?
Well, good afternoon, everyone, and thank you so much for inviting me to join you today. And thank you, Dr. Joseph, for that question. You're absolutely right. It was February of 2020 when Mayor Ginther declared racism a public health issue and charged Columbus Public Health, providing some recommendations for our community of what we could do to address it. And I think him naming it, which has already been mentioned this evening or this afternoon, is really important. So as a result of him naming it and us taking on that charge, Columbus Public Health established the Center for Public Health Innovation. This center has one simple focus: to increase life expectancy by reducing health inequities and raising the quality of life. So simply put, this group is going to look at a variety of issues, most notably the social determinants of health. And then they're going to provide some tangible, real data and analysis on how all of these factors are consciously decreasing the years of life for our Black and Brown residents. and then recommend interventions, and some of which we've already done during the course of this pandemic.
Thank you so much for that, Dr. Roberts. And once again, thank you for being here today and for all the great leadership that you provided, not only today, but throughout this whole pandemic and even pre-pandemic. I know that it's been a long year and a half for all of us. So truly appreciate your time and your perspectives. Dr. McDougall, let me go to you next. How is Ohio State changing existing cultures to build anti-racist environments? I know you are our new chair, our co-chair of the Anti-Racism Action Plan with Allison Mincy. Would love to get your perspective on that.
A very good question, Dr. Joseph, and thank you for convening this important talk. And when Dr. Walker was speaking and she brought up Dr. Kamara Jones, that made me think about the theoretical framework for racism, A Gardener's Tale. That's a must read, where she speaks to personalized racism, personally mediated racism, institutionalized and internalized racism. It also made me reflect on some of the initiatives that have been ongoing at The Ohio State. And I think and look at our African American mentoring roundtable that we convene for our Black medical students here. And I think about Dr. James Moore and the Todd Anthony Bell Resource Center for the African American male, leading to some of the highest retention rates for Black males in the country. And then to address your specific question, Dr. Joseph, the Anti-Racism Action Plan, and I do co-chair the Oversight Committee with Allison Mincy, Vice President, Associate Vice President for Human Resources. So we're building out the infrastructure to support inclusion, diversity, equity, and anti-racism. So for example, across the Wexner Medical Center, the James Cancer Center, the Health Sciences colleges, they all actively participate in development and implementation of the ARAP, otherwise known as the Anti-Racism Action Plan. We have 9 action groups led by group champions such as yourself, Dr. Joseph, education and training, policy and advocacy, population health and community engagement, employee engagement and advancement, faculty and staff training and development, resources and external partners, patient experiences and clinical services, communications, and last but not least, the group that you co-champion, Dr. Joseph, analytics and evaluation. So we are also fueled by the funding commitment of the Wexner Medical Center, and likewise, the College of Medicine has developed an anti-racism action plan guided by the leadership of Dean Carol Bradford. And as you know, Dr. Jennifer McAllister, our Associate Dean of Medical Education, and Dr. Demisha Rankin, our Associate Dean of Admission, co-chaired the anti-racism work group. And similarly, Dean Bradford has provided financial support. So listen to this. So we have 26 departments across our medical college, and we have appointed 26 vice chairs for diversity, equity, and inclusion. So these initiatives that we're speaking to, they are funded. So that helps us to advance this mission to eliminate racism and focus on anti-racism to build a culture where all can thrive.
That was great, Leon and Dr. McDougall, and you really kind of gave us a lot of the ongoing activities there. And I, as you spoke, I thought about, one of the important pieces of that is that all of those different committees have been working hard for coming up on a year now and really advancing in all of those areas to build that culture that you were discussing. So thank you so much for that comment. I will go back to Dr. Roberts next. And Dr. Roberts, COVID-19 has taught us many things about the community's perspective on getting vaccinated. We've all been out there and we've all had those conversations. The health disparities in vulnerable communities and the lack of trust in the medical profession is a major issue. How is Columbus Public Health changing existing processes, culture, internal practices, as well as policies to build an anti-racist environment?
Great question. And, I think Dr. Walker touched on this earlier in her comments. It's really important that all of us, when we're dealing with racism, that we really differentiate equality versus equity. I think all of us are familiar with equality. We provide everybody the same thing, and we assume that everyone will be successful with the same exact tools. That has failed us. We've been doing that for a while and it's not working. So equality has had its day. And now we really have to look at equity, meeting people where they are and providing them what they need for where they are in life and our community with their resources. And so what we've learned through this pandemic is there are some in our community who need a little extra help, who need a little extra talking to, who need more specific education, more dialogue, more time to talk to healthcare providers to understand this virus known as COVID-19, but most importantly, to understand the vaccine and how it works, and for them to feel more comfortable with the vaccine. So what we've been doing at Columbus Public Health, and I've had many partners in the community to assist us in doing this, is really trying to reach out to our minority community, provide them that education, but meet them where they are. Don't assume that they're going to come to the Schottenstein to get their vaccine like so many other people have. Don't assume they're going to come to the Celeste Center at the fairgrounds to get their vaccine. Go to their community, go to their church, go to their block, their rec center, and provide the vaccine, but not just providing the vaccine, but also providing them that education. Don't just assume that because you show up in their neighborhood, they're going to come and get the vaccine. They might have some additional questions when you show up, and be prepared to answer those questions before they will be prepared to roll up their sleeves. So to that point, one of the things we did at Columbus Public Health, and we're really leading the nation in doing this, is we launched a program called Vax for Cash. And what it looks like to most people is we went and provided the vaccine in a variety of community locations. But it was so much more than that. What we did is we looked at census tract data and we looked to see where there was low vaccine uptake. And what we found is it was traditionally in our Black and brown neighborhoods, our low income neighborhoods, what we like to call our socially vulnerable neighborhoods. And so we identified locations, rec centers, community-based organizations in those census tracts, and we set up shop there to provide the vaccine. We also surveyed the community and said, what do you want? And what we heard loud and clear was they did not want pop-up vaccine sites. They didn't want a clinic that would just pop up at this church on some random Monday, and then the next week they would pop up at another location. They wanted consistency. They wanted to know that they could rely on us to be there Monday after Monday and Tuesday after Tuesday. So we set up a schedule just like that. And then in addition to that, we went and knocked on their doors. We worked with community partners and we went and knocked on neighbors' doors in areas where we were going to be providing the vaccine and saying, hey, we're going to be there tomorrow, or we're there today. And so in addition to all of that, we also offered the $100 Visa gift card. And anyone starting their vaccine series through us, no matter which vaccine they got, so whether they got the 2-dose Pfizer or Moderna, or the 1-dose J&J, they received a $100 Visa gift card as long as they were eligible for the vaccine. So anyone 12 and older, that they could do whatever they wanted to do with that $100. And I have to tell you, we had to fight for that. The state gave us some money to incentivize individuals, but initially they told us we could only give $25. Now, we all know, at least the four of us on this call, $25 isn't much of an incentive for most people in our community who are hesitant and reluctant to get the vaccine. They also told us they didn't want us to give cash cards. They wanted us to go to a store and buy a store card. Well, I fought and said, if you look at my residents in the Linden neighborhood, they have no full service grocery store. They have no Walmart, no Target. And other than a McDonald's and maybe a Church's Fried Chicken, there aren't too many places that I could give them a gift card in their community. And so you're really putting them at a disadvantage. So finally, with the support of the Mayor Ginther and City Council, I was able to convince the state to give us some flexibility to do that. And so this is where we landed with the $100 Visa gift card. But that's an example of how you have to do really equity, and it's not all about equality. And then the other example that we did even before the pandemic was we noticed that if we looked at our food service industry here in Columbus, which Columbus Public Health licensed, we found that many of our minority owners who did not have English as their first language were getting into trouble and having more and more violations that were putting their food license at risk. So we quickly learned that not only did we need to provide education in those different languages, food service education, but we also needed to provide pamphlets and signs in different languages so that they could be up to par, so to speak, with their English speaking counterparts. And that served to be very, very effective. And we quickly saw less offenses in that ownership for businesses in the food service industry. So those are just two examples of things that we've done. I could probably give you a list of many others, but it really looking at equity over equality is so important.
Yeah, a couple of things I heard there, Dr. Roberts. I heard data, really being able to understand which communities. I heard place-based solutions, and I heard equitable solutions. So kind of moving from equality all the way through equity is a need as we go forward. So thank you for that. And I know that as we think about vaccinating more children as time goes forward, I know you'll be putting a lot of those same strategies that you've developed over time into place. So thank you for that. Dr. McDougall, I'm going to come back to you now and ask you, what have been the key components in your efforts to actualize the promise of the statements on racism that may be beneficial for other organizations around the country? So, thinking about, all these organizations, we're all trying to move in this right, direction. It seems like you've made a lot of progress, not only at the Ohio State University Wexner Medical Center, but also in some of your efforts at the NMA. Can you talk about, that piece?
Thank you so much. Another excellent question, Dr. Joseph. And first of all, I want to make a correction is what we have done. And in my leadership roles, one being faculty for the Association of American Medical Colleges Healthcare Executive Diversity and Inclusion Certificate Program. That's a mouthful. I have an opportunity to serve as faculty for diversity leaders across the 155 medical schools in the US and 17 in Canada. And there are some themes that develop with the mentoring that I provide. And so one, I would say to answer this question for other organizations, one cannot be afraid of failing and letting that failure prevent one from proceeding. What am I saying? Dr. McDougall, what are you saying? So there may have been an event or perhaps a member of the leadership who kind of put their toe in the water of an anti-racism event, and things may not have gone as well as that person or the group of persons thought. And there may be some reserve or reservation to getting back in the water. And so that can't be so. So just as we do in medicine, we frame things in a continuous quality improvement methodology. And learn from what went well and what didn't go so well, and keep it moving. And so you just can't let that fear paralyze an organization from trying to do the right thing, because this space that we live in regards to diversity, equity, and inclusion and anti-racism, I define it as constructive uncertainty. So however, with that, try to keep moving forward to advance our inclusiveness goals. And so what else? Also, it requires all hands on deck, right? It can't be something where the initiatives are marginalized to be implemented only by people from those historically underrepresented groups. It requires everyone, even those from non-minority groups, to provide leadership. And that's what we are doing with the anti-racism action plan. When you look at our members, it's diverse across leadership, race and ethnicities, including majority populations across the institution. So those are some of the keys I think I would speak to in this question.
So what I heard there, Dr. McDougall, is that you got to put the effort forward, and that sometimes when you do that, it may go well. Sometimes there may be missteps. And when you have those missteps, you have to, understand what went wrong, recalibrate, and kind of do better in the next attempt from that. And that you have to have a big group of folks. You got to have everybody on board. I think were the two things that I kind of heard in there. And so I want to remind everyone that if you have questions, you can put them in the chat, and we're going to have an extended question and answer period session, not only with Dr. Roberts, Dr. McDougall, and Dr. Walker, but also Dr. Dean Bradford will join us for that as well. So let me go to you next, Dr. Walker. I know I took a little break from you. Those first two responses were so great. I wanted to make sure I gave you a little time to think about a couple of questions that I have for you. The next question I have for you is, from the lens of anti-racism, describe the importance of anti-racism in leadership of health and public health organizations and existing efforts in this area. And I asked this question because I've seen over time a lot of the great work kind of going on at Nationwide Children's Hospital around this. Take it away.
Absolutely. Thank you for that question. And that's why I think it was important for us to start with that shared definition of racism from Dr. Kamara Jones, because some people may be saying, why me? Or I'm not racist, or, well, I'm not Black, or how can I get involved? One of the keys about racism, right, is that it saps the strength of the entire society. We are wasting everyone's resources. And when we live in a society where we can other people, where we can dehumanize people, then it's not just racism. It's also sexism. It is homophobia. It is xenophobia. It is ableism, where we aren't even really considering accessibility issues for people with different or disabilities. And so fighting racism is really about, again, as clinicians, as healthcare professionals, as people who are responsible for healing, that we are really trying to heal those that come into our care. So one of the things, some people may know, I joined Nationwide a little over a year ago. Prior to that, I was in California at UCLA. And you could say, oh, UCLA, it's a big school and it's California, everyone's like super liberal and things like that. But I can tell you, to your point about Nationwide Children's Hospital, we have leadership that is genuinely committed to this work, and they are not running away from the term that we use, backlash, right? So there are things about racism that people find very difficult to see or believe. We know that there are often false narratives, misinformation, and disinformation that makes it seem that if you're trying to dismantle racism, that you're actually being racist or you're perpetuating reverse racism. And I want to be very clear, that is not what it does and how it should be done. So I admire our leadership, and many of our leaders, truthfully, if I were to call out an identity, are older white men. But the way that they understand and see that idea that everyone deserves to be fully valued, fully humanized, fully appreciated, has been key to that. And so we do have, and to Dr. McDougall's point, we've made mistakes and we've had to say, rather than run away and say, we won't do that again. I mean, it's just like being a baby. When a baby first learns to walk, they fall, and sometimes they cry when they fall. But babies don't stop trying to walk, and they definitely want to get to the point where they learn to run. So we can take that developmental milestones approach that we have in pediatrics and childcare and say, we're going to continue to develop and grow and push things forward so that we learn from our mistakes and we get better. So with our STAND initiative at our hospital, similar to what's happening at the larger OSU and WexMed, we're looking at every single system and structure. How do we hire people? How do we make sure we have equity in pay? Depending on if you're doing a similar job as someone else, that they don't get paid more just because they're a man, for example. How are we making sure that we're bringing in the community? And so we have each of these pillars. And when people say, oh, we don't like what you're doing, we don't like how you're doing it, we also listen to those people, because again, we recognize there's a lot of misinformation out there. We're also doing things around justice. What it looks like when children have family members that are incarcerated. What does it look like when communities are simultaneously being over-policed and underprotected? And we know that if you don't feel safe, then you're stressed. If you're stressed, your blood pressure is high. If Dr. Roberts did a great example talking about the lack of resources in certain communities. Well, if I tell you I want you to exercise and go outside and find green space and you don't have that, then I'm disconnected from your reality. So the fact that our hospital has been very intentional about looking at this at every single angle and having that all hands on deck that Dr. McDougall talked about, I think is a part of how we're being successful. But really the key is, even as this backlash happens all around us and a lot of these really divisive conversations that are currently taking place in our country, we're still focused on how do we heal? How do we prevent trauma? How do we stop causing harm? And doing it in a way that does rely on data, that holds our leadership accountable and our leadership accepting that accountability as we move forward.
Thank you so much for that, Dr. Walker. And I will remind everyone that you can place questions in the chat and we will have our leaders answer them. I will actually invite Dean Bradford back on to the session and we will open it up for question and answers. And the first question from the audience is going to go to you, Dr. Roberts. It is there anywhere we can see the new Center for Public Health initiatives and research? People want to engage with the center and want to understand the great work that the center is doing.
Sure, that's a great question, and thank you for asking it. As you can imagine, with the pandemic, we've been pulled in a lot of different directions. The Center for Public Health Innovation opened in April of 2020, right at the height and the beginning of the pandemic. So we're still working on a dashboard or something where people can actually follow our progress, as well as looking at ways where the community can get involved and understand exactly what we're working on. But to find out some information, I encourage you all to go to our website, which is publichealth.columbus.gov, and you can follow the center as well as the work of Columbus Public Health there.
Perfect. Thank you so much for that, Dr. Roberts. And the next question is for Dr. Walker. And the attendee said, congratulations on this great work and great to hear of the accountability piece of leadership. And we know accountability is really key in any process that we want to move forward. Can you share how the measures of success within that accountability?
Absolutely, that's an important question. So there are a few different things that are in process that we're working on and trying to finalize. And again, it's happening at different levels of the organization. I spend a lot of my time, so I'll give most of my answer focused on this as it relates to like the type of people that we train, our future physicians in pediatrics, the pediatric subspecialties, our faculty that we hire to also train those. So there was a concerted effort over the last few years to increase the numbers of what we call URIM, underrepresented in medicine, in terms of trainees in our pediatrics residency program. And we've had significant success increasing that percentage. Beyond that, we're now working on our subspecialty and our fellows and looking at our faculty. How do we say, a lot of people are like, oh, we just can't find them. Oh, where do they exist? But learning to partner with places like our historically Black colleges and universities, but also making sure that we aren't just going to the same schools. Not all Black people go to Harvard. Not all, Hispanic people are at Yale. And just, and in particular, when we think about like our Indigenous Native American, like we have to go where they are. And we have to make sure we have a space that we don't just trick you into coming here, but that you know that you belong and that you're included once you're here. So we have specific numbers and metrics that we have to meet every year, and we're moving those goals, that we don't just stay satisfied. Well, we got to 10%, we got to 15%, we got to 20%. We're also thinking within our local community about our Somali and our Nepali populations, and making sure that even though maybe across the entire country, they may not be a significant percentage, but they matter here in Columbus. So how are we bringing in more of our staff and our trainees that represent those populations? I think some of the other things that we're trying to do around accountability involves our research. Who do we ask to show up at the table? Who's contributing? Do we just go into a community like Dr. Roberts said and have a pop-up and say, thank you very much and never come back? Or are we really partnering and saying, what do you need? How do you need it? And how can we make it better? And how can we make sure that you get credit for your expertise, because you live in that community? You know what it takes and where the barriers are versus someone, quote unquote, sitting in an ivory tower. So really trying to reach those numbers in terms of engagement and making sure that the work we do really reflects what's needed, and being able to demonstrate that you don't just have the same few people that have traditionally been accepted getting like NIH grant funding and things of that nature, that we're truly creating opportunities for everyone to excel and do the work that's needed to dispel some of these notions that, people don't do well just because they don't know, or people don't do well because they're biologically different. Those things are all factually incorrect. You can't have good health if you don't have a grocery store with healthy, fresh food. That's just one small example, but that really allows us to unpack the history of how our neighborhoods got so segregated. And I know that's a bit of a long answer, so I'll pause there and hopefully leave that as a little tease for something we can talk about before we finish.
Perfect. Thank you so much, Dr. Walker. And the next question will go to Dr. McDougall. So the question is, how do departments integrate their own diversity, equity, and inclusion efforts, as well as initiatives, within the broader framework of the larger medical center and the College of Medicine?
A very good question. I'm enjoying this discussion this morning. So we have 26 departments, 7 or so of those departments are basic science departments. And those basic science departments and the clinical science departments are working together through our initiative that was established by our dean. Dean Carol Bradford came here from the school up north and is making an immediate impact. So she is funding this initiative through the College of Medicine, and I'll be convening meetings with our vice chairs for diversity, equity, and inclusion. And when we look at that term, vice chair, so that means that we have high-ranking faculty within our academic departments that are driving change, working with the GME, graduate medical education. So we're talking about residents and fellows, our faculty, staff, and students. So within our strategic plan that it's being rolled out, and our ambition to our ambition statement across the College of Medicine, we're aligning our goals to advance diversity, equity, inclusion, and anti-racism. So part of this will be our regular meetings with the vice chairs for diversity, equity, and inclusion. That'll be an opportunity for all the leadership in this space, including the department chairs, et cetera, to be in alignment and share ideals and promising practices across the group. I know that was a lengthy explanation, but hopefully that helped answer the question.
And I would tell them to reach out to you as well, right, Dr. McDougall, as they think about aligning those efforts, so that we're not having duplicative efforts, as well as supporting individuals in the various practices and processes and procedures that they may be putting in place. So fantastic. Thank you for that, Dr. McDougall. The next question is for Dean Bradford. But before I get to the question, I'm going to actually ask, because the question is about intersectionality and the intersections of kind of racism with sexism and other isms, including body weight and maybe anti-fat bias. And so first, before we get to Dean Bradford, Dr. Walker, I've seen you give a fantastic talk on intersectionality. Can you give us 2 lines on intersectionality? And then we're going to go to Dr. Bradford to talk about, how do we think about these intersections that we know are so critical in these spaces?
So you saw my face light up as soon as you said the word intersectionality. So intersectionality is a framework, and it was put forward by Professor Kimberly Crenshaw, who's a legal scholar. And it's the idea that you have to consider multiple identities as a person has and how that might shape the way they go through an environment. So for example, I'm a Black person, I am a woman. When I experience racism or when I experience sexism, it's compounded by the fact that I am both. If you have someone who is gay and they may be disabled, what they may encounter, and let's say they are Latino. So a Latino, gay, disabled person navigating the healthcare environment will experience very different things than someone who maybe primarily identifies as Latino or primarily identifies as gay. So I'm just using those quick examples, and hopefully that sets the stage for Dean Bradford's answer.
That sets the stage perfectly for Dean Bradford. So Dean Bradford, how are we to think about these intersections? We clearly have work going on around sexism and sexual discrimination. We clearly have work going on around racism and anti-racism. And then there's so many other isms out there. Tell us a little bit about that intersectionality and how we can address that.
So thank you. It is really a great question. And I think my answer is going to surround two things. One is culture, and the second is education. So we have to create and embody and be role models of culture where every person we come into contact and all of their background, all of their intersectionality, all of their identity, where every single person has the opportunity to thrive, to feel valued, and to excel in our communities, as well as for our patients. Everybody has access to equitable, compassionate, high quality, safe care. So we have a core value and a culture statement that says all forms of diversity are celebrated. And I will add, in our brand new, just rolled out College of Medicine strategic plan, we have as a bold pillar diversity, equity, and inclusion. Again, not equality, equity. And we also have as its own pillar health equity. And it's just so important that we educate the future healthcare professionals, scientists, and leaders of the field about implicit and unconscious bias, that we recruit a diverse workforce. So again, so that we have that intersectionality in all of our conversations and all of our dialogue, that we do in fact engage with our community partners. We go into the community to listen, to learn, and to understand what are the challenges people are facing and how can we come together as a community to address those challenges. So I think it's a great question. I think it's a journey. I think it's a journey that will have complex dialogue, conversations, and learning. And I'm proud to be the leader of what I think is a learning community, because there's so much so much work we must do to educate all of us, myself included, on how we can be the best in this arena.
Thank you so much for that, Dean Bradford. And so with that, I'm going to bring the question and answer segment to a close. Please reach out if there are other questions, and we'll be happy to get answers back to you. I want to thank Dean Bradford for her participation in the question and answer session. And I will move on to the one action item session. As many of you know who've seen these ROARs over time, we ask really for one action item to come away from this session with as we continue to move forward in anti-racism. And so I will start with Dr. McDougall. So from your perspective, Dr. McDougall, what is one key action item kind of to move forward on?
So a very good question, Dr. Joseph. So I would say key components to this for this action item would be approaching this with cultural humility. And what do I mean by that? It's a process of reflection and lifelong learning, and to couple that with alignment of leadership. That's a major strength of the Ohio State. And I'm talking about from the Board of Trustees to President Christina Johnson, our new provost, Melissa Gilliam, our Chief Diversity Officer, James Moore, our College of Medicine Dean, Carol Bradford, and our Health Sciences Deans and department chairs. So that alignment, institutional alignment, is so important to really move the needle in this space.
Thank you so much for that, Dr. McDougall. I will go to Dr. Roberts next. So what have been the key components in your efforts to actualize the promise of the statements on racism that may be beneficial for other organizations, Dr. Roberts?
Great, thank you. And I think I'm going to go back to what we've been saying this afternoon is it's really about equity and not equality. And you called it out earlier too, Dr. Joseph. It's following the data, getting good data, following that data and doing place-based along with the equity. And, I think there's so many examples I could give of how we get caught up on this premise of, well, then it's not equal and we need to give the same thing to everyone. And we've got to get away from that. We've got to move away from that. And we've got to think of the bigger picture. And so I really want to focus on that equity, data-driven and place-driven.
Perfect, love it. And Dr. Walker, last but definitely not least, what have been the key components in your efforts to actualize the promise of the statements on racism that may be beneficial for other organizations?
I think I echo Dr. McDougall and Dr. Roberts. There's humility, there's accountability, there is a willingness to apologize for mistakes that have been made, and make efforts to do better. And that means earning the trust of our patients and our communities and valuing their expertise and how we do better. In a very concrete way, we are also creating toolkits for our leadership, for our managers. Hey, if you don't have expertise and you've never done this before, these are resources, and we're working with them, simulation and practice sessions on how to do this better.
Thank you so much for that, Dr. Walker. And if I could take the moderator's perspective, first I want to thank all of you for your excellent answers. When I look at this great panel, I think about the pandemic and how each of your organizations has made a tremendous impact here locally in Central Ohio, but that you've done that through an anti-racist and equitable lens, which has just been critical. So thank you for your time today. Thank you for your answers. And as I mentioned earlier, if there are other questions that come in after the session, I will be sure to pass those along to you so that we can get answers for our audience. In the closing here, I want to say thank you to everyone for joining. We have a survey that will go out to all of you, so please complete that survey. And if Barta could bring up my final closing slides, that would be great. And I want to introduce the next topic. This topic will be moderated by Dr. Dina Chisholm from Nationwide Children's Hospital, who I introduced you to earlier. And the topic for winter 2021 is going to be policy and politics of health, how policies and politics impact the health and well-being of a community and its people. And that really gets back to much of that community engaged focus that was discussed earlier in the webinar. If you're on the webinar today and you say, hey, I want to hear more about this, I want to learn more about diversity and health equity through diversity, I also encourage you to join this session next week, Friday, October 1st. It's noon to 1:30, diversifying the clinical and clinical research workforce from K-12 to senior healthcare leadership. We have a number of national and international experts in this space who will be discussing different pipeline programming opportunities that they've been engaged in over time, as well as workforce diversity within their own organizations. We also have a breakout session as part of that, so you can give your opinions and have that back and forth. And the one big difference with this conference versus most conferences is we really invite in the community. So there may be barbers on the call, for instance, kind of discussing these topics. So in closing, I want to thank everyone for joining today, and most importantly, for continuing to engage in building a culture here at the OSU Wexner Medical Center that supports all individuals and has anti-racism and equity as key components. Have a wonderful day, and we will be back with you soon.